Question 1. Staphylococcus epidermidis. A 75-year-old woman undergoes hip replacement surgery. 2 weeks later, she presents with low-grade fever and localized pain. Blood cultures are positive for a coagulase-negative, gram-positive cocci. The organism forms biofilms on the prosthetic material. Which of the following is the most likely causative organism? A. Staphylococcus aureus, B. Staphylococcus epidermidis, C. Streptococcus pyogenes, D. Enterococcus fecalis, E. Clostridium perfringens. Correct answer, B. Staphylococcus epidermidis. Explanation: S. epidermidis is a coagulase-negative staph, part of normal skin flora, and a common cause of prosthetic joint and catheter infections due to biofilm formation. Why not the others? A. S. aureus is coagulase positive. C. S. pyogenes causes cellulitis and pharyngitis, not prosthetic infections. E. fecalis causes UTIs, endocarditis, not primarily prosthetic joint infections, causes gas gangrene, not biofilm-related infections. Question 2. Viridans streptococci, S. mutans, S. sanguinis. A 23-year-old man with a history of congenital heart disease develops fever and malaise after recent dental work. A blood culture grows alpha-hemolytic optochin-resistant, gram-positive cocci. The organism is known for biofilm formation on heart valves. Which organism is most likely responsible? A. Streptococcus pneumoniae, B. Staphylococcus aureus, C. Streptococcus mutans, D. Enterococcus faecium. E. Neisseria subflava. Correct answer, C. Streptococcus mutans. Explanation: S. mutans and S. sanguinis are viridin streptococci that form biofilms on damaged heart valves, leading to subacute infective endocarditis, often enter bloodstream following dental procedures. Why not the others? A. S. pneumoniae is optochin sensitive, not associated with dental work or endocarditis. B. S. aureus causes acute aggressive endocarditis. D. E. faecium causes nosocomial infections, often drug-resistant. E. Neisseria species can cause endocarditis, but not via biofilm on teeth valves. Question 3. Pseudomonas aeruginosa. A 12-year-old boy with cystic fibrosis presents with worsening cough and increased sputum production. Sputum culture reveals a non-lactose fermenting, oxidase-positive gram-negative rod that produces blue-green pigment. Which virulence mechanism is most important for chronic lung colonization in this patient? A. Capsule production, B. IgA protease, C. M protein, D. Biofilm formation, E. Urease production. D. Biofilm formation. Explanation: Pseudomonas aeruginosa forms biofilms in the respiratory tract of CF patients, contributing to chronic colonization and antibiotic resistance. Also causes ventilator-associated pneumonia and contact lens-related keratitis. Why not the others? A. P. aeruginosa is not encapsulated in the classical sense like Klebsiella. B. IgA protease is made by H. influenzae Neisseria, not Pseudomonas. C. M protein is a virulence factor of Streptococcus pyogenes. E. Urease is produced by Proteus, H. pylori, and others, not Pseudomonas. Question 4. Non-typable Haemophilus influenza. A 3-year-old child is brought to the pediatrician with fever, irritability, and ear pain. Otoscopic exam reveals a bulging erythematous tympanic membrane. The child has had multiple episodes of otitis media. A swab from middle ear fluid grows a small gram-negative coccobacillus that does not produce a capsule. What is the most likely mechanism allowing this organism to persist? A. Endotoxin production, B. Antigenic shift, C. Biofilm formation, D. Polysaccharide capsule, E. Spore formation. Correct answer: C. Film formation. Explanation: non-typable unencapsulated H. influenzae causes otitis media, sinusitis, and COPD exacerbations. Lacks a capsule but forms biofilms, especially in the middle ear and respiratory mucosa. Why not the others? A. Endotoxin LPS contributes to inflammation but not chronicity. B. Antigenic shift is a feature of influenza viruses. D. Non-typable strains lack a capsule unlike type B strains. E.